more.
Liberal.
Hi, Jim Jeffries, the Hoot Owl with Big Country 99.5, and you've heard his commercials on the radio, and now you get a chance to meet him personally, Dr. James Webb.
Hey.
Hey, Dr. Webb. Come on up here a little closer, Amber, to the desk here. Dr. Webb, why don't you tell people a little bit about yourself?
Well, I grew up out in Kellyville, Oklahoma. You know where
Did
that
you
is.
really?
Yeah, you guys have a ton of listeners out there.
Oh, we sure do, yeah.
Yeah, we're always tuning in, and went to Kellyville High School. I did college in Shawnee at Oklahoma Baptist, and then medical school and everything at OU.
Wow.
So I kind of was lucky to be able to do all my training in Oklahoma, and then I moved back here to Tulsa, opened the practice, and focused mostly on osteoporosis, bone health, and helping people avoid like spinal surgery and chronic pain patients. So.
And that chronic pain is important because a lot of people suffer from that, don't they?
Absolutely, yeah. It's an epidemic, and patients and doctors are kind of crushed between a lot of issues with, not wanting to prescribe potentially addictive medications,
right,
and all the problems that can come with complications of that stuff. So.
And of course, with today's medicine too, there's also lots of medications that people take that hamper their bone health, isn't there?
Right. When I was in medical school, we all knew that steroids are a big cause of osteoporosis, and ours is kind of the first generation that's had those inhaled steroids, like for asthma and things, so that we see a lot more of that. But even in the last 4 or 5 years, there's been some big studies that have shown that some common medications that I've used, that other people that...
And Dr. Webb, one of the things with today's over-the-counter medications have caused a lot of problems with osteoporosis, hasn't it, or causing it?
Yeah, I mean, we're kind of the first generation that's had over-the-counter inhaled steroids, and even in medical school, we knew, when I was back in medical school, we knew that steroids were kind of hard on your bones and can cause osteoporosis. But in the last 4 to 5 years, there's been some major studies that have shown that certain medications like acid blockers, like the classic purple pill.
Oh, yeah. Yeah, we've all heard that, haven't we? Yeah,
yeah, and like the anti-anxiety, anti-depression medication, a lot of people are on. That class, SSRIs, which would be like, different medications, those can all cause, and they may be worse than steroids.
Really?
Yeah.
Wow. So, and those are prescribed a lot these days.
Absolutely, yeah. And a lot of times they're kind of a necessary evil. I mean, they're bad on the bones, but for whatever reason, patients, for example, patients may end up, if they weren't on an acid blocker, they might have really bad GI symptoms like an ulcer and things like that, and people die from that.
Yeah.
So a lot of times those are necessary, but unfortunately, longer term, those may be really impacting bone health in a bad way.
And we are into Osteoporosis Awareness Month here, and this is obviously a time that people really need to be aware of that kind of thing, osteoporosis.
Right, yeah. I mean, most people that we see in the clinic that find out that they have osteoporosis, they're surprised. First of all, osteoporosis is a really long word, and it's kind of hard to say, and it's like we get it in our minds. It's something that my grandma might have had. Or
something like Hippocrates or something like that, right?
Yeah, and exactly. It's a big, the $20 word. So I like to use bone health to talk about whether they've got good or bad bone health. It's a little bit more understandable, and the bone density test that we do kind of measures bone density, and that's one measure of bone health, but it's not the only one.
And that's why people, as they get older, if their bone density is less, that causes fractures, breakage, and stuff like that, right? Right,
and that's the most common type of fracture, probably 750,000 vertebral fractures a year from that type of osteoporosis. And that's what I tend to call, little old lady osteoporosis, because in the public mind and even in doctors, unfortunately, kind of get stuck on that vision of, an elderly lady in a nursing home that gets these fractures. But we see it in patients 60 and older, and there's another kind of osteoporosis, like the kind that's caused from other medications or vitamin D deficiency or low testosterone or whatever, called secondary, meaning it's secondary, it's caused secondary to something else. And we see that in patients as young as their 30s sometimes. So,
wow, that's amazing.
Yeah, I had a patient that was 24 that had that really severely.
So you don't have to be old to have osteoporosis then?
No.
Or some form of it anyway.
No, but it's way more common in patients over 40.
Yeah.
But if you can identify factors that might be impacting your bone health at a younger age, then you can take steps to reverse those, like most commonly being like low vitamin D.
Sure,
or other issues like that, stopping smoking. I mean, we're always talking about smoking, but that's probably one of the worst things for bone health.
Now, what can people do about osteoporosis? They come to your clinic, you can get a scan.
Yeah.
Take us through the process.
Yeah, so what we're doing this month for part of Osteoporosis Awareness Month is we're offering a $75 DEXA, which is those typically cost about $300. I think it's the national average. And so most patients, if they've got insurance, it's probably not going to be out of pocket to them. And also, if somebody can't really afford that can't afford the $75, then we're going to do it for free anyway.
Oh, that's cool. That's very cool.
Yeah, just for this month to try to get get as many people screened, just to kind of know, so they have an idea what their bone health is. And so, if a patient came in just for that, even they'll come in. Well, you went through the process today.
Yeah, right? I did. Can't wait to see my results here in just a few minutes.
Yeah, we'll talk about that. So they can come in just for a screening bone density test, and then we'll get the results to them and let them know it's you kind of are laying on a table for just a couple minutes. And
yeah, I did. I did that, and it was painless.
Yeah,
kind of relaxing, actually.
Yeah, exactly.
So now, why don't you tell the people who are watching this on the website right now how to get a hold of you, and the phone number and where you're located, sir?
Sure. Well, the best way to get a hold of me is my mom, but I'm not going to give her number out. But no, you can call us at 918-260-9322, which is 260-Webb for people that like to do those letter things, but I never do. So it's 918-260. I'm sorry. 918-260-9322.
There you go.
On the web at drjameswebb.com. That's 2 B's. Or by our Facebook page, you can message us too.
And you're just east of 71st and Sheridan, real easy to get to here.
Right.
In Tulsa.
We're right here, just
right across from Southern Ag.
Exactly, next to Arvest Bank here. So, and there's a car detailer right. I mean, there's a lot of nice little hometown shops and things, and that people come for services in this area, in this little neighborhood. So it's really cool. And we're about just about not even quite a mile west of the mall. So.
Now you look like you're getting ready to go on the road with your band here.
That's right. I don't usually look like this in clinic. It caught me on a day where I'm doing kind of housekeeping.
You don't look real doctorly today.
I don't, exactly. Right, yeah.
So what are you going to be doing?
Well, we're getting ready. I have a CD that's my second CD that's come out, and we actually got featured on iTunes.
Cool.
Which is pretty cool. So that's increasing things for us and been helpful. My artist name, I sing country music, kind of traditionalist type stuff, kind of like Garth Brooks type things.
You have a great voice too. I've heard your music. Yeah.
Thank you so much.
Yeah.
I'm James Robert Webb on those days when I wear a stethoscope by day and a guitar strap at night.
There you go.
So my album's called Honky Tonk Revival. You can go out and listen to it on Spotify or pre-order it. It comes out on May 19th. And
you have 2 CDs out now.
I have 2. That's the second one. The first one's called Pictures. So.
Pictures.
Yeah.
So Dr. James Webb, Osteoporosis Awareness Month. Sorry about that. He's here with me, and I'm looking forward to hearing his results here in just a couple seconds. Well, Dr. Webb, I had my scan this morning, and looking forward to hearing what you say about my results, what the Hoot Owl's got going on with his bones today.
That's right. Well, thanks. I know Jim came in because you'd had a family history with your mom.
Yes, my mom had osteoporosis. Yeah,
and that does increase the risk some, but there's other factors. Now, smoking currently, if you can have low testosterone, different things like that can be issues. Low vitamin D, and those things can affect the bone quality. But what we're measuring with the bone density test is the bone density. So bone health is kind of 2 things. One is how dense or strong are your bones, or how thick. And the other is how healthy they are. So when they get little tiny fractures that we get every day with normal wear and tear, how fast do they heal? Is there a thing? Are there things that are impairing it, like you have not enough calcium or not enough vitamin D?
Sure.
Things like that. So this tests mainly for the density of the bone. So if we look here, it's pretty simple, and these are all kind of standardized from a huge database from the World Health Organization and broken down by guy, age, sex, and some genetic stuff. So in your spine, you have what we call a T-score, is a good result for kind of saying, do you have normal bone density? Are you kind of somewhere in between with low mass, or do you have probably full-blown osteoporosis? And it's important to know that that's kind of a spectrum, And so somebody can have a really low bone density but not have fractures. And somebody can have a normal bone density and still have fractures. So this is only one part of the diagnosis. But in your spine, you have a T-score of minus 1.2, which would be classified as kind of low bone density. So already we have a little low bone density. It might not be as severe as some people. So like a lot of patients that have osteoporosis already, would have, we would expect them to have a T-score that's minus 2.5. And for those people that, you know, did you ever have a math teacher and you asked her, you know, am I ever going to use this stuff? And, you know, right? And she said, well, the smart kids are going to use it.
Yeah, right,
so
exactly.
What a T-score is, if you remember standard deviation, it's like when you have you take measurements of a group of people, and it's kind of like the standard of how many, the average, and then how many you fit people in that average. So a T-score minus 1.2 is basically 1.2 standard deviations outside of what we'd expect. So, so it is low enough, and so you can imagine when you get to minus 2 or minus 3 that's really significant. The other part we do here also is we do a lateral view. We're looking from the side of your vertebrae to see if there's any fractures.
Yeah.
The good news here is we didn't see anything, didn't detect anything on that test. Now as the doc, I'm going to take a look here and make sure I kind of agree with everything. I don't see any. I've kind of looked through this already. I didn't see any technical problems, but we measure in the spine, we measure in the hip, and then we measure in the forearm. And those all give different information. And then one thing I like to do we should really all be doing it because it's a free tool. It just takes a little bit of time, but it's called a FRAX, F-R-A-X. And this is University of Sheffield in the UK, and they kind of developed this, and it's been, you know, we use it basically internationally. But basically you plug in your numbers. You know, you plug in your height, your weight, your age, and then a few factors. You know, like, are you a current smoker? Has your parent fractured a hip? Is there a previous fracture? Is there rheumatoid arthritis? Things like that. And then we check that. And then that basically calculates what's your risk in the next 10 years of having a major osteoporotic fracture, like a vertebral fracture, wrist fracture, anything. And then also your risk for having a hip fracture, because those are more significant because they're almost always going to require surgery, usually hospitalization, and a little bit more risk for complications and death. You know.
So in some ways, you're predicting the future of your bone health.
Right, absolutely. So it's kind of like a little crystal ball to some extent to how likely are you in the next 10 years to fracture. So based on your numbers, you're probably about 5.3% chance to have a major fracture in osteoporosis, but less than a 1% fracture, less than 1% chance of having a fracture of your hip. So generally, those are low enough risk numbers that we probably wouldn't treat. But with your family history and the fact that your bone density is already a little bit low, what I would probably recommend for you is, number one is I would check some blood work to make sure your vitamin D is not, you know, very low, or some other things like that. You know, stopping smoking is always a good idea if you're a smoker. And then I would probably, based on, you know, we'll see what we find on those results, and that might change things. But in general, I'd say probably, you know, kind of repeat in a couple of years because of your risk to see. But that's pretty much the information we get, which is very helpful. So it helps people who have questions like, you know, for example, you've got a family history of osteoporosis, have a couple of risk factors, and even though you've got low bone mass, you're probably a little bit less likely to need medical treatment at this point. But there could have been other, you know, if you had worse bone mass or other findings, we might have, you know, changed how we treated you. So.
Sure.
And your doctor has to take this information into account with everything else to kind of come to a diagnosis and decide what's best for you.